Well, the West Yorkshire and Harrogate Healthy Hearts programme was an initiative that was set up to reduce cardiovascular risk in the population across West Yorkshire and Harrogate. It's a population management approach, so it's designed to be applicable across the whole of primary care in this region, and it was designed to be easily rolled out and easily adopted. It started with bold ambitions, and this was to reduce the risk of cardiovascular events by over 10% over the 3-year period it was initially set up for. And we were aiming to reduce the number of heart attacks by 800 across the region and the number of strokes by 350. And we anticipated that would lead to a big cost saving of over £12 million in the health economy for our region. So the reason we set up the Healthy Hearts programme was that we realised across our region we had a high prevalence of cardiovascular risk. There were problems with health inequalities and underattainment of risk factor modification. So we figured that we had to start with a large number of people with hypertension that were not being identified and not being treated. And then we recognised we had similar issues with lipids and with diabetes. So we decided to address that. The way we addressed this was to generate a set of resources which are available through a website, and these include one-page guidance for primary care practitioners, along with resources for patients and resources for primary care to be able to perform searches to identify patients with high blood pressure, lipids that need treating, and diabetes. So phase 1 was to identify patients with hypertension across the patch, and we developed pragmatic guidance for GPs in order to initiate antihypertensive therapy. This was based on NICE guidance and other national guidelines, but in a simplified and pragmatic form with a stepwise escalation of therapy.
One of the risk factors for cardiovascular disease, specifically atherosclerotic cardiovascular disease, is high cholesterol. And one of the arms of the Healthy Heart was to tackle cholesterol at population level, to better identify high levels of cholesterol and to tackle any inertia in better prescribing of lipid-lowering therapy, mainly focusing on high-intensity statins and the use of ezetimibe, but potentially referring patients who might need further optimization of their therapy. And that was to be done at primary care level with the support of secondary care where needed.
So in phase 3, we started looking at how we sort of identify and how we optimize or regulate high CVD management in patients with diabetes. We started delivering education with webinars around our guidance and also around the theory behind it. So I think one of the wonderful things that has come out of the Healthy Hearts programme is what we had not seen across our region or across our area before. And that was actually talking to each other. So where we found primary care teams talking to primary care colleagues, but more importantly, primary care teams talking to our specialists in secondary care. And that really is at the heartbeat of Healthy Hearts, is creating a platform for which we can develop and implement further things that are relevant to our region. The programme has really helped us achieve high quality improvement across the region. So if we look at the Healthy Hearts programme, particularly around phase 1 alone, our original ask or plan was that by undergoing blood pressure optimisation to specific population cohorts, it would allow us to prevent at least almost 300 heart attacks and over 400 strokes across West Yorkshire. And then on top of that, an additional saving to our local health economy in terms of an estimated £8 million as well. If we look at hypertension in particular, we've increased the register by greater than 22,000 patients, and an additional 17,000 patients across our population were treated or optimised. If we look at our second programme around lipids, again, we've had almost 11,500 patients who have had statin switches. So by statin switches here, we've moved from low-intensity statin to a high-intensity statin. And just under 2,000 patients with a Q risk above 20% were prescribed a statin.
So what we wanted to do, or what we want to do through the Healthy Hearts programme, is to align. Our guidelines are absolutely aligned with the update to the NICE guidance, but what we want to do is to provide a practical approach to how clinicians can actually identify patients with cardiovascular disease or at high cardiovascular risk in practice, and how they can deliver the guideline-directed therapy that NICE has recommended. I hope my legacy from the Healthy Hearts Project is that as a cardiologist that I've been able to influence people in my region to recognise the importance of cardiovascular disease reduction and use my own knowledge and skills to interact with colleagues in primary care so that we can scale up cardiovascular risk reduction across a larger population.
What I have personally perhaps achieved or gained through this is perhaps more confidence, more importantly, how to become an engaging leader, an influential leader, how to understand data and articulate complex scenarios into more meaningful, engaging conversations with my peers, colleagues, meds management teams, commissioners, or even the wider public in terms of how we take everyone along with us on that journey.
I'm really proud of Healthy Hearts. Probably first element is the collective working, is that cardiovascular disease became something of concern, not just to a specialist like myself or Steve, or it became of concern of everybody within primary and secondary care, importantly in primary care. And also this collaborative approach made it look like patient belongs to all of us, not just to one sector as such, and that we are also there to support. So that came kind of clear, and all the data collection and the talking about the challenges that everybody's facing made me, at least from secondary care perspective, seeing better what my colleagues in primary care are facing, the challenges, how can we support them. That element of better collaboration to better serve patients' needs, that was definitely a highlight for me.
I think the future's exciting for Healthy Hearts. You know, we've gone through 3 phases. I think for me, if we had a crystal ball, I think the next phase 4 and phase 5 particularly will be focusing around 2 key domains that are still probably left for us to tackle in the cardiovascular space, predominantly heart failure, and again another passion of mine, which would be CKD. So I think we just need to wait and watch, but I would imagine, you know, it's not the end of Healthy Hearts. I think it's going strong, and over the next few years we will see these 2 phases come into action.